And we're live. All right. Doing GI today. Setting up the YouTube link so everybody can see us. All right. Dropping that down. All right. And Jeff, I'm going to give you a little break for a little bit, okay? You don't get to go first today.
Okay.
All right, Colleen, you're in order first, so you're going first. We need to have those answers. All right, you ready?
Uh-huh.
All right, Colleen. The nurse is caring for a client with active herpes simplex 1 lesions. Which intervention should you implement to prevent the spread of the virus?
Two?
It is wear clean gloves, providing care. All right, Jeff, you were second. Now, does that feel good?
Suits me, bro.
Client receiving antibiotic therapy complains of white, cheesy plaque in the mouth that bleed when removed. Which action should you implement?
One.
Need some of that antifungal. Got some candidiasis of rolling. Which instruction, Jen, should be discussed when the client diagnosed with GERD?
Number 3.
Edith. Do not eat spicy or acidic foods. These are fun. All right, Robert. When assessing the oral cavity of an elderly client, which data should the nurse report to the healthcare provider? He's reading. Yes, Robert? He's got a 1 up. The answer is 1. Yes, we're worried about pernicious anemia, evaluated by the doctor. Yeah, see that tongue? That's right. Colleen. Which complaint would be significant for the nurse to assess in the adolescent male client who uses oral tobacco?
Three.
Are you sure?
I think so.
Ah, my bad. Where'd my thing go? 5. There we go. You got it right. Non-healing sore in the mouth. All right. Jeff, the female client's diagnosed with ulcerative colitis. Which symptom would warrant immediate intervention by the nurse?
Oh my goodness. A client who has a hard and rigid abdomen.
Yes, that would be bad. Welcome, Mike. Make sure you mute yourself. We are recording.
Sorry.
It's okay. You're fine. You all right?
Yeah, when I wake up, I'm congested.
Gotcha. All right. Jen, which expected outcome would be appropriate for the client diagnosed with aphthous stomatitis?
Number 2.
Client will receive, that is not, no. They do not have malnutrition.
Okay. Number 1.
Yes, the canker store. They don't know, but small ulcers usually occur due to stress, viral infections, allergies.
I guess I was thinking number 2 because they don't like to eat when they have those.
In theory, that's correct.
Sorry.
Let's see. Mike. Mike. The nurse is administering a PPI to a client diagnosed with PUD. Which statement supports the rationale for administering this medication?
gonna go with 2.
It is not 2.
It's not 2.
That's the histamine receptor antagonists.
It's not 3. It's not 4. So 1?
It is 1. That's the rationale for a PPI. Yep.
Wow. Okay.
Proton pump inhibitor. Proton pump hydrogen proton.
Yeah, I got you. I was torn between 1 and 2, but
As long as 50-50 shot, we're doing good. So, Robert, which task can the nurse delegate to the unlicensed assistant to improve the desire to eat in a client diagnosed with anorexia? Robert's at work, so he's got to put his finger up for us today. What you think, sir? Give it a guess. We did talk about this.
is it bad if we don't like any of the answers, though?
Yeah, go ahead. Yes, Robert, it's 3.
Yeah.
Yes, Robert, it's 3. The nursing assistant assisting the client with meals needs to increase interaction to improve the client's appetite and make it an enjoyable occasion. All right, Colleen. The male client with a rule-out colon cancer is 2 hours post-sigmoidoscopy procedure. Which intervention would warrant immediate intervention by the nurse?
Four.
Yes, we have started our hypovolemic shock. Jeff, the nurse identifies the client problem of alteration in GI system for the elderly client. Which statement reflects the most appropriate rationale for this diagnosis? Jeff?
I'm here, bro. I'm reading.
Oh, got you. Sorry.
Huh. Well, I'm going to say 4.
It is 4.
Oh,
Yep.
okay.
No, the motility of the GI tract decreases, bacteria remain in the gut, multiply, which results in diarrhea. All right, Jen, the nurse is teaching a class on diverticulosis. Which intervention should the nurse discuss when teaching ways to prevent an acute exacerbation of diverticulosis? Select all that apply.
2, 3, and 4.
You got it. Drink 2,500 mils of water. Avoid eating foods with seeds so we don't get our itis. And walk 30 minutes a day. Prevent the constipation. Mike, a nurse in an outpatient clinic is caring for a client 67 inches tall and weighs 100 kilograms. Client complains of occasional pyrosis that resolves with standing or with taking antacids. What treatment should you expect the doctor to order?
I'm going to go with 1.
Yes, that's the information given. That's the answer you give. Place the client on a weight loss program. All right. Robert, the client's 1 hour post-op laparoscopic cholecystectomy. Which intervention should the nurse implement? It is not 1 because this is laparoscopic. It is not 2 because this is laparoscopic. The answer is 3. Done in day surgery, you must start talking about your discharge orders, etc. Usually open is when you see a T-tube, and you wouldn't see these abdominal dressings. It's usually a couple Band-Aids, if you will. All right, Colleen, which information should the nurse teach the client's post-barium enema procedure?
Three.
Yay, laxatives, finally the answer. All right, Jeff, the client diagnosed with a hiatal hernia has been scheduled for laparoscopic niacin fundoplication. Which statement indicates the nurse's teaching has been effective?
I'm going to say number 1.
It is 1, yes. Technically, it's a day surgery, but it does not everyone gets to do this, and this is teaching them about it. So 3 to 4 small incisions, laparoscopic again. All right, Jen, the client's been diagnosed with esophageal diverticula. Which lifestyle modification should be taught by the nurse?
Number 2?
It is number 2. The evening meal should be eaten at least 2 hours prior to retiring. All right, Robert, I'm going to skip you on. Actually, we've got Mike for this one. Client weighs 160 pounds and is 5'1". Calculate the BMI using the following formula.
All right. You'd think they would have taught this to us, right?
Mm-hmm. Well, the formula is there for you at the very least.
Well, I know. I'm doing it.
There's no rounding rules here for that.
No, there's not. Give it the best you can. Give it the best you can.
I got 30.23.
Yeah, it's 30.2, but yeah, that's the BMI they give you. Is that you got the idea? All right, Robert. Based on the client's BMI from question 18, which category should the nurse document in the client's medical records? Looks like he's talking to somebody, so we'll skip him for right now. Colleen, based on the BMI of 30.2, which category should the nurse document in the client's medical records?
Can you go down further?
Oh, yes, you probably need to know that.
Or obese.
Yay! I didn't see the chart. Sorry. All right. Jeff, which intervention should the nurse implement specifically for the client in end-stage liver failure who is experiencing hepatic encephalopathy?
Let's assess their neurological status.
Look at that. That's nice and pretty, isn't it? All right. Jen, which priority teaching information should the nurse discuss with the client to help prevent contracting Hep B?
Number 2.
Yeah, 3 doses. Look at that. Look at that. Why is there 2 Jeffs now?
I have no idea. I just got a thing that says that the signal was lost and then it popped back up. I have no idea what happened.
Okay, you're fine.
As far as I can tell, there's only one of me.
All right, Mike. The nurse is working in an ER of a community
Missed the
hospital.
question. I missed that answer though.
Oh, sorry. Give 3 doses of Hep B.
Okay.
Get 3 whole doses vaccine. All right, Mike. The nurse is working in an ER To me, yeah, I'm ER. During the past 2 hours, 15 clients have been diagnosed with salmonella food poisoning. What information should you discuss with the clients?
I'm gonna go 3.
It is 3. Explain the one source of potential contamination is eggs. All right, and Robert's still busy. Choline. Which intervention should the nurse include when discussing ways to prevent food poisoning?
Two.
That's not 2.
Well, I like all of them. That's the issue. 1.
3. Foods that are being served for an extended period should be kept at 140.
Well, you don't want cross-contamination between your meat and your fruit either.
Let's see. I'll read them to things for you. 1, hand washing is not long enough. You need at least 30 seconds. Cutting surfaces used for meats should be different than used for fruits and vegetables.
What if you can't afford but one cutting board?
That's not. This is.
That's not an option.
Nope. And all fruits need to be washed prior to, so you need to use a different cutting board.
Okay, then.
Which nursing diagnosis would be appropriate, Jeff, for the nurse to identify for the client with diarrhea?
Well, I'm pretty sure if you have chronic diarrhea, you've got ineffective coping, but alteration in skin integrity is probably the answer.
Yes, it is. All right, Jen, the nurse is assessing a client complaining of abdominal pain. Which data would support the diagnosis of bowel obstruction?
Oh. Number 1?
It's not number 1.
Number 2?
It's not number 2. It's actually
Oh.
4.
Crap! Sorry.
Intermittent colicky pain located near the umbilicus is a small bowel obstruction. Lumbar pain is indicative of colon involvement.
Wait a minute. Okay.
Yeah,
I
steady aching pain is peritoneal inflammation.
Biggest echoing.
Yeah. Sharp pain in the back and flank indicates kidney involvement. Sharp pain that increases with deep breaths indicates muscular involvement.
I didn't read the question correctly.
Ah.
I don't know that I would have known the answer, but I still didn't read the question correctly.
You should read the question. Mike, the nurse is caring for a client scheduled for an abdominal perineal resection for stage 4 colon cancer. When preparing the plan of care during surgery, which client problem should the nurse include in the plan of care?
I'm gonna say 3. Hello?
26 would be not 3.
4.
It's actually 2.
Wow. Okay.
The perfusion of the surgical site is compromised as a result of the surgical incision, especially when the graft is used.
Gotcha.
For 3, infection would be potential, but not at the time of surgery. And after surgery, not during surgery, the client may require chemo, which would cause immunosuppression. All right. Choline. The nurse is assessing a client in end-stage liver failure who has been diagnosed with portal hypertension. Which intervention should you implement in the plan of care?
Sorry, I couldn't read it. I was zoning out. Give me just a second.
You're fine.
Two.
It's not 2. Remember, portal hypertension does not give you high blood pressure.
Three.
The actual answer is 1, the tympanic wave.
For the love assess.
Watch for the check for ascites. We're checking for ascites. All right, Jeff, the nurse is caring for the client diagnosed with ascites from hepatic cirrhosis. What information should the nurse report to the healthcare provider?
That we found it by tympanic wave. The nurse is caring for the client with ascites. Let's say an increase in abdominal girth of 2 inches.
That's it. Indicates ascites is increasing.
That's a bigger tympanic wave, right?
Blub, 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 blub. All right. Jen, the nurse is caring for the client diagnosed with hepatic encephalopathy. Which sign and symptom would indicate that the disease is progressing?
Number 2.
Number 2? Yes, you got it. All right. Mike. The client scheduled for colostomy as a result of colon cancer. The surgeon tells the client the stool will be a formed consistency. Where would the nurse teach the client stoma will be located? Mike? Okay. Colleen, that one's yours again.
Okay. I want to say D.
It is D. You got a nice formed at the very end. Yep. Jeff, the nurse is speaking to a support group for clients diagnosed with Crohn's. Which information would be most important for the nurse to discuss with the clients?
I'm going to say 1.
It is. We're talking about a support group. Objectives for support groups are to help members cope with the chronic disease and manage symptom control. Jen, the nurse is caring for a client diagnosed with ulcerative colitis. Which symptom supports this diagnosis?
Number 3.
Got number 3, multiple bloody liquid stool. All right, Mike, I'm going to let you off, and I'm just let you be until you come back on. So, Colleen, the nurse is teaching the client diagnosed with inflammatory bowel disease. How about therapeutic diet? Which food selection would be the best choice for a meal?
4.
It is 4. Meats can be eaten if prepared by roasting, baking, or broiling. Vegetables should be cooked, not raw, and skin should be removed. Low residue diet should be eaten. Don't irritate it anymore. Jeff, the elderly client has been diagnosed with acute gastritis. Which client problem would be priority for this client?
Well, if they have all of those, impaired tissue perfusion would be the worst.
There we go. 34 is not tissue perfusion. Not the priority over this other thing.
It's not.
Mm-mm.
Well, you know, if your tissue's not perfused, it dies. I'm thinking that's a pretty high priority. But
Not over this other thing.
say what?
Not over this actual answer.
Oh, really?
Mm-hmm.
Well, if you have gastritis, acute gastritis. I guess we're going to go with fluid volume deficit.
That's it. Pediatric and geriatric clients are the most at risk for this. Electrolyte imbalance, and the nurse should always be alert to this possible complication. Hold on, both of those guys are having an issue, so I'm going to re-invite them. Hopefully they can get back in without an issue, but they're having issues. Gotta move on.
Yeah, something happened to mine a little bit ago and it shut off, but it came right back on by itself. I didn't do anything, so I don't know what's going on.
Okay, well, we'll make sure. Let's see, we've got Jen. The nurse is caring for the client diagnosed with chronic gastritis. Which symptom would support this diagnosis?
Number 3.
It's not 3. That would be acute gastritis, not chronic.
Number 2.
It is 2. Chronic pain in the epigastric area relieved by ingesting food is chronic gastritis.
Is that what the rationale says, or is there more?
That's what it says. I'm just reading rationales.
No, I guess I was associating that more with an ulcer.
Could be.
So that's the reason I didn't choose that one. I was just...
Ulcer can occur from a chronic gastritis.
Okay. Thank you.
Mm-hmm. Colleen, the nurse identifies the client problem of fluid volume deficit for a client diagnosed with gastritis. Which intervention should be included in the plan of care?
I'm going to go with 4.
Yes, watch that IV site. This would be the most appropriate to implement because of fluid infusion. Jeff, the nurse working in a skilled nursing facility, is collaborating with a dietitian concerning the meals of a client who is immobile. Which foods would be most appropriate for this client?
Immobile. Let's go with tuna for calcium.
It's not tuna.
Dang. Okay.
Good for protein, but there's a high fat content on the croissant.
Mm-hmm.
And applesauce is low fiber.
Applesauce is low fiber?
Mm-hmm.
Well, I don't hardly see how that's true. An apple is basically nothing but fiber. But okay.
I think it's the peel of the apple that gives it the fiber.
The rest of it's accessory tissue, I thought.
Well, let's say 3 then.
Apparently people have. The actual answer is 1.
Really? Tell me why 1.
Oatmeal and wheat toast are high fiber, recommended for clients who are immobile to prevent the constipation.
That's the only rationale?
That's the only rationale.
Well, people who are immobile are also supposed to have an increased calcium intake because their bones are losing calcium.
Agreed. But
Due
this
to
is talking about,
immobility.
and this is talking specifically apparently about that. The immobility. You think if it says immobile, you think constipation as well.
Okay.
All right. Jan, which intervention should the nurse implement when administering a potassium supplement?
Intervention. Number 2.
Yes, that's atypical heart rate. Choline, the nurse is preparing the client for fiber optic colonoscopy for colon polyps, which task can be delegated to the unlicensed nursing assistant.
Four?
It is 4, yep. Give him the enema. Jeff, the nurse is caring for a client that's one-day post-upper GI series, which assessment data warrants immediate intervention.
One.
Yep, no bowel movement. We got that. Bury him in there. Jen, the client's complaining of painful swallowing secondary to mouth ulcers, which statement indicates the nurse's teaching is ineffective.
Number 4.
Avoid spicy foods, tobacco, and alcohol. Yep. Choline. When assessing the integumentary system of the client with anorexia nervosa, which finding would support the diagnosis?
One?
No.
4.
It is 4. Thin, dry, brittle hair. We're looking to confirm it. Preoccupation or psychosocial behavior suggests they have an eating disorder. Okay. Let's see. Who just did that last one? I'm sorry. That was that one. So Jeff, the nurse is teaching the client diagnosed with colon cancer, scheduled for colostomy the next day. Which behavior indicates the best method of applying adult teaching principles?
One.
Yes, exactly. The nurse should realize the client is anxious about diagnosis of cancer and impending surgery. Therefore, the nurse should be prepared to repeat the information. All right, Jen, the nurse is caring for the client one-day post-op sigmoid colostomy operation. Which independent nursing intervention should the nurse implement?
Number 2.
It is feelings. All right, Choline. The nurse is caring for the client recovering from intestinal surgery. Which assessment finding would require immediate intervention?
Four?
Number 4 on 45 is right. Yep. All right. Jeff, the client's been diagnosed with hemorrhoids. Which statement from the client indicates the further teaching is needed?
Okay. It's number 3.
And have a stool daily. Yay. They don't need that. Jen, the nurse is preparing the post-op nursing care plan for the client recovering from a hemorrhoidectomy. Which intervention should the nurse implement?
Wow. I'm gonna say 2.
It's not 2.
Okay, the number 1.
It is 1. Causes embarrassment. Establish a rapport.
Okay.
Choline, the client's recently been diagnosed with IBS. Which intervention should the nurse teach the client to reduce symptoms?
Oh, geez. 1?
Yes! This will prevent abdominal distension, which causes symptoms of IBS. Do not confuse IBD with IBS. Flatus forming foods will prevent symptoms of IBD. Clients with IBS do have altered bowel habits, and IBS does have a psychological component, but a client recently diagnosed should be taught other interventions.
What was the answer to that one? I'm sorry.
The answer to this one was 1. Instruct the client to avoid drinking with IBS.
Okay, thank you.
All right, Jeff, the nurse at the scene of a knife fight is caring for a young man who has a knife stuck in his abdomen. Which action should you implement? Take it out.
Pull it out.
Take it out, Jeff.
Well, twist it first, then pull it out. Okay.
What about applying pressure?
No, I'm thinking you should stabilize the knife.
Stabilize the knife. Do not remove any penetrating object in the abdomen.
That depends on who they are, too, you know?
Jen, the nurse writes the problem risk for impaired skin integrity for a client with sigmoid colostomy. Which expected outcome would be appropriate for this client?
Number 1.
Intact skin around the stoma. Yep. All right. Choline, the client's admitted to the emergency department complaining of acute epigastric pain and reports vomiting a large amount of bright red blood at home. Which intervention should the nurse implement? List in order of priority.
Okay. 1, 4, 5, 2, 3.
Oh, you got it!
Crushed
Test of vitals. Start an IV. Type and cross match for blood. Insert an NG. Begin iced saline lavage. All right. And now we're going to actually pause the channel because we're going to switch over to a different set of questions.